Here are the assistive devices. First of all, we have to define what are the assistive devices, what is the definition of the assistive devices, and why we have to use the assistive devices. That in what cases, what are the cases in which we need the assistive devices. After that, first of all, we have to introduce the clutches, their advantages, disadvantages, along with how to use the clutches and instructions to be given to the patient as a nurse. That what are the instructions that we have to give to the patient. That is, next we have the instructions, that what are the instructions that as a nurse we have to give to the patient while the patient is using the clutches. So after that, there is the ways to use the clutches. Here are 2-point scale, 3-point, 4-point and swing through gears. Here there is a table that is defined that how we walk through with the help of clutches. After that, the second assistive device that we will mention, that are the walkers. So here are what is the definition and introduction to the walkers, the instructions that has to be given to the patient as a nurse while the patient is using the walker. Then there is a how to use the walker, that is how we have to bear our weight throughout when we are using the walker. That the first point is when we have fully dependent on the walker, that we have to put our full weight on the walker. Then there is a partial weight, and then there is a no weight bearing and walker. That in first that इसमें हम अपना जो पूरा वेट है वो खुद ही कैरी कर रहे हैं, लेकिन स्टिल हमें एज असिस्टिव डिवाइस हमें वॉकर की ज़रूरत होती है. पार्शियल वेट बेयरिंग कि हम अपना थोड़ा सा जो वेट है वो खुद अपना क्या है शिफ्ट कैरी कर सकते हैं. सो पार्शियली वेट के लिए हमें क्या वॉकर की ज़रूरत होती है. एंड थर्ड पॉइंट, हम अपना जो पूरा वेट है वो वॉकर के सारे अपना क्या है कैरी करते हैं. देन दिस इज वॉकर सेफ्टी, डेट हमें कैसे अपनी इंजरी है जो वो प्रिवेंट करने वाइल यूजिंग दी वॉकर्स, द एडवांटेजेस एंड डिसएडवांटेजेस. एंड द लास्ट वन इज canes. First is definition and introduction to the canes, that they are also known as walking sticks. Then there is they are the types of the canes, that is standard, offset, quadripod, hemi-cane, and their advantages along with their disadvantages. After that, there are some instructions that we have to provide to the patient. The cane safety, that what are the instructions that we have to provide to the patient to prevent any injury. Then how to use the cane. Then in the table drawn below the usage, we mentioned the clutch, walking gait. Then there are the nursing responsibilities, that what are the nursing responsibilities and what are the responsibilities of the patients while the patient is using the walker, during the clutches and during the cane usage. These are the points that we have to keep in our mind while the patient is using the assistive devices. And the overall nursing responsibility, that if the patient is using any kind of assistive devices, what are the responsibilities and what are the points that one have to keep in his or her mind are mentioned at the last. So today we have discussed about the assistive devices in orthopedic. Hopefully you like it and understand it. Thank you.